Well, good morning, Decatur. This week, Morgan County was reclassified as high risk instead of very high risk by the Alabama Department of Public Health. That means we're making progress, and progress is very good news during a pandemic. Thank you to each member of our community for doing your part, and we must stay the course. I'd like to introduce today's guest. With us, we have from Decatur Morgan Hospital, President Kelly Powers. Kelly has graciously joined us over the past several weeks, and will actually start at the hospital Monday week. Is that right?
Yes, sir.
You're kind of doing double duty right now.
A little bit.
Okay, well, very good. We certainly look forward to you being a part of our community. And then we have with us from the Alabama Department of Public Health, the administrator for the Northern District, Judy Smith. Judy is a favorite. We always get a lot of good feedback on Judy and what she has to share. But you are a welcome guest, and we appreciate you being here, Judy. Just a couple of municipal updates. Current Morgan County COVID cases were at 1,933, which means cases increased by a little over 15% this past week. It's about personal responsibility. We all have to do our part. As we can see, our hard work is paying off, but we can't stop now. We must socially distance, wear a face mask, wash our hands, and disinfect. It's through the completion of those crucial steps that we can keep ourselves well, keep our families healthy, and sustain our local economy. Here at City Hall, we're happy to serve you, but if you will, please reach out to the department that you have to do business with first by phone, email. That may save you a trip. Also, we always want to remind you, if you have not already done so, to please complete your census at my2020census.gov. That's my2020census.gov. Be sure to call someone in your neighborhood and check on them, especially the elderly. That's something we enjoy reminding everyone. And then I want to mention that we had some really good news to come to the city last week. It happened on Friday, and it's unrelated to COVID, but it's something that I think it's important to announce. So this is an agreement that was announced between the Alabama Department of Environmental Management and 3M on cleaning up our environment. Today, I'm a Rotarian, and Director Lance LaFleur will be the guest speaker at our Rotary Club of Decatur. And I'm in favor of anything that improves Decatur's environment. I commend ADEM and 3M for securing this consent order, and the fact that there is a plan and enforceable commitment to clean up the sites and prevent further contamination is good news for the city of Decatur. I look forward to studying the roughly 60-page order in more detail and working with ADEM and 3M to take these important steps that will enhance our community. So with that, now I want to toss this over to, I'm going to start with Kelly, if you will.
Yes, sir.
And if you will just share what you have.
Yes, I just wanted to tell you, as of today, at Decatur Morgan Hospitals, we have 25 inpatients. 3 of those are on the ventilator. 7 of those in ICU, 3 on the ventilator, and 11 that are positive under investigation, meaning we think they have COVID, but we haven't gotten their test results back. Jenna had asked me last week some information about availability of beds, so I want to follow up. Currently, we have 200 inpatient beds between Decatur and Parkway, and there is currently 128 of those filled. So they're not all COVID patients, but of that we have 72 still available inpatient beds. We have 27 ICU beds, and 18 of those are currently filled with 9 available. 7 of the 18 are COVID. So I guess that leaves about 15 or 16 inpatients that are non-ICU patients of the 25. So just wanted to share that with you, that we do have capacity for patients. Our ERs are open, ready to see patients and make sure we get everyone that needs to be checked. I did want to tell you this, that the fever and flu clinic at Parkway is open Monday through Thursday, 9 to 12 and 1 to 3. So if you need to get tested, please come there instead of the emergency room if you're only coming for a test. There has been a delay in getting results back. We're working really hard on that, but it's not us, it's the labs that are still somewhat behind. So, act like you're positive. If you think you have it, and have been tested and you haven't gotten your results, please act like you have it until you get those results back. We have heard some people say, well, I went and I got tested, so I can just do whatever I want to do until I find out my results. Well, that's not the case. You're the people, even though you put a mask on, if you are positive for COVID, you need to stay at home, stay away from other people, all of that. So I wanted to share that with you. The other thing I wanted to say was, this last Saturday, I visited several small businesses around Decatur, which I'm very impressed, by the way. Very nice businesses, boutiques, and everyone had a mask. They had their sign up. They had hand sanitizer and were social distancing. So I was very proud of that, to see that in the small businesses.
Good.
So just wanted the community to know that I felt safe in every business that I went in. So,
It's good to hear, Kelly. Thank you.
Thank you.
So whenever residents go to the Fever Clinic at Parkway campus, the Ed Morgan Parkway campus, should they bring any particular documentation with them?
Bring your insurance card if you have it. If you don't have insurance, it will be covered. That is part of Trump's order that everything's covered. So we will get paid the Medicare rate.
Do you need an ID if you don't?
Yeah,
have-
you need your ID. Yes,
Okay,
sir. Sorry,
okay.
yes.
Okay, all right.
I just want to make sure everybody knows that they don't have to pay. Even with copays, I don't think there's any copays collected
Okay, all
on
right.
that. So
Thank you.
You're welcome.
Thank you. All right, Miss Judy, good morning.
First of all, I want to say how wonderful it is to get Kelly's report, and I do truly pray that we're going in the right direction, and that does sound like good news. I will tell you, across the state, that is not the way things are, and again, overnight, we added almost another 2,000 cases. I think when we were talking like in the state, I think when we were talking like a week ago, we worried about hitting the 50,000 cases in Alabama, then the 60,000 cases. Folks, we're getting close to hitting the 80,000 cases. As a matter of fact, by the time I get back to the office, we will be very close to that. If I were to have a byline for my remarks today, it would be while we are waiting. And, while we're waiting, we will have a vaccine. We are going to have a vaccine. The trials are going great. The trials look good, but they're still a distance away. Will we have it by the end of the year? I don't know. Will we have it by the spring of next year? Certainly we hope so, no later than that. But the bottom line to it is, we've still got a gap there that's while we are waiting. So while we are waiting, what do we do to take care of ourselves? And I want to take you a little bit down history lane and tell you that a little over 100 years ago, we had a disease that was transmitted by respiratory methods. It was called tuberculosis, and it was in lay terms called consumption, because it literally consumed the human body. And one of the things that happened with tuberculosis is we had no medicine, we had no vaccine, we had no whatever. So what did we do? We did the best we knew how to do, and that was we separated people. Actually, some of the separation was pretty intensive, because we actually had a hospital here in Morgan County that was a tuberculosis hospital, so that people could be away and not expose other people. Somewhat after that, we had the flu that we've all referenced so much, the 1918 flu. And to be honest, it was terrible. It was one of the greatest pandemics that this nation has ever seen, actually that the world has ever seen. Some 50 million people in the world died. And actually in the United States, some 675,000 people died. So what did we do? We didn't have a vaccine. We didn't have whatever. Now folks didn't travel like they do right now, and so staying separated was a little bit different, but those were the things we did. And quite honestly, if you look at the data on that, within 2 years, now we don't want to wait 2 years, but within 2 years, because of the steps that these folks took without a vaccine, things got a lot better, because we knew we needed to be separated. Now, a condition that's it's not a contagious condition, but I will mention that I never got to know my wonderful grandfather, who reputedly was a large man in all ways in a small town in South Carolina, because he died with diabetes while he was waiting on insulin. He was waiting on the vaccine type thing for diabetes. As a small child, I will also say that we dreaded, our parents dreaded spring and summer, and my Rotarian person over here will understand this, because there was a terrible virus that had a paralyzing effect on many, many people. Most of this audience, I doubt, even knows what a iron lung is, and I don't want you to ever know, but there were iron lungs, and again, what happened is parents kept their children out of groups, families stayed out of groups, and, you know, we did what we needed to do. Now, one of the biggest problems that we in public health have right now is, how do we get the message out there that this is serious? I appreciate your remarks about you do get some positive feedback, you know, when I come, because I need those kudos once in a while. But, you know, what do we say? What do we say that makes this meaningful? There are a lot of people that still think this is a hoax. Folks, I'm going to tell you something. When you have 1,428 people in Alabama who have died, to those people, it wasn't a hoax. To those people that have been in the hospital, and right now, today, we have cumulative had 9,100, almost 10,000 people that have been in the hospital with this disease. 12% of the total cases is what that represents. It's not a hoax to them. And if you all want to give feedback about what we could say, how we could say it, that in such a way that would make this meaningful. When I go home, what I hear is, all we ever hear from you on that little press conference is wear those masks and stay away from each other. I'm still going to tell you, wear those masks and stay away from each other. While we are waiting, we will have a vaccine. I want to take you back just a little bit to the rest of the story of those diseases. Tuberculosis is still here. You all never hear anything about it because we now have treatments that do so well, you don't have to worry about it. Public health still deals with it, but you don't have to worry about it. The 1918 flu, I'll tell you what, let me come back to that one because I want to kind of end it on that. Diabetes is still an issue today, but we have so many types of insulin that manage folks, but these are still, you know, and that's wonderful because of progress in technology that has gotten us to where we need to be. Polio, and in part thanks to the Rotarians, polio is virtually in the United States an eradicated condition. It is not in other countries, and because of that and because of our travel, we continue to give vaccines for that. But while we were waiting for those vaccines, folks still did what they needed to do. I said I wanted to come back to the flu. We now have flu vaccines. We don't worry about the flu that was there in 1918. And I will tell you today that one of my greatest goals in all of this is to have you all tell me that I'm not taking that flu shot because I'm going to get the flu when I get it. I hear it every year. Someday, 100 years from now, if history proves itself true, folks will still be dealing with some level of tuberculosis, some level of the flu, some level of diabetes and polio, and dealing with COVID. But again, my hope is that what you'll be saying to me is, I don't want to take that flu shot because it'll give me the flu. Right now, I'll let you, excuse me, I'll let you say that. And yes, I do know that the real terminology is, for the movie, was while you were sleeping. But what I don't want you to do is I don't want you to be sleeping. I want you to do what it takes for us to take care of this, continue to go in the direction that Kelly was talking about. I know that a lot of you, and I could tell a lot of sad tales, but I know a lot of you know that it's wonderful that so many people are following the rules, but I'm sure that some of you read the article in AL.com about the religious group that decided to have the revival, and in having the revival, they ended up with 40 folks that were positive for COVID. The additional complaint that we got is that a lot of them didn't want it to be known because they were afraid it would reflect badly on the congregate group, and in addition that some of them went on to work. And you know, we are just trembling right now out of concern about what this may do. Please, folks, don't get it and don't give it to anybody else. And just to be honest, I'm going to conclude on a light note. Again, I appreciate the mayor saying that every now and then I have positive kudos. I'll tell you the ones I hear the most is about my tan. And just so you know, I have not been to the beach. I would gladly go if somebody wants to take my job and finance the trip. It comes out of a bottle. You can buy it at any one of the big box stores, and it is in short supply because I do have to buy a good bit of it. Now, I will say to you that if you go to get it, please wear a mask when you go in, and if it's only the last bottle left and I'm the only one that's there, please let's social distance while we fight over it, if that's okay. The other thing I do hear about occasionally is my spiky hairdo, and I wasn't terribly concerned about it until I realized that it was my hairdresser that was putting those notes on there. So with that, listen, we're still on your team. The hospital's still here for you. Public health is still here for you. And if you have ways that you think we could better communicate the need to respond to this virus that's still affecting 2,000 people in Alabama every day, that's still putting people in the hospital, that's still stretching hospital capacity across our state, feel free to let me know. We certainly will look into how we could do it better. Thank you so much, and thank you, Mayor.
Thank you, Judy. Thank you for making yourself available. Kelly, thank you for making yourself available. I lost my great-grandfather to the Spanish flu.
Did you
Yeah,
really?
Sure.
Wow.
So anyway, he was 43 years old, way too young to pass away.
Right. Hey, I want to make one remark about that, just so, history, in case y'all can't tell, I'm a little bit of history buff. One of the things when you read about the Spanish flu, it talks about that the reason people tended to be more concerned was because it affected so many young people, like the 20 to 40-year-old age group. What they don't tell you is there wasn't any old people then. There wasn't. The life expectancy in America at that time was 54 years old. There wasn't any of us over 65 years of age. So please keep protecting those of us who are over 65 years of age.
So yesterday, our numbers of positive tests in Morgan County, we were at 19. Today's number just came in at 40. So, and then we had one additional death. So anyway, Amy, do we have any questions?
Not at this time.
Okay, Jenna?
First question for Kelly. Do you know how many employees, I know last week you had said that there were 45 employees out of the hospital. Do you know what those numbers are today?
I do not. Sorry. Since I'm not there yet, I
That's
don't
okay.
really know.
No, I just wanted to ask
Okay.
because I know that we wanted some sort of an update from last week to see if it had gotten any better.
Any worse, yeah.
Or worse.
Or worse. Hopefully not.
Judy, can you talk a little bit about your concern? I know you've said a time or two before that you want kids back in school, but we have flu season, right around the corner. What's your concern with kids going back to school next week or in 2 weeks, and then, the flu coming right in September?
Well, the first thing I want to say is I cannot commend enough the effort and energy that school officials have put into trying to make a safe environment for these children. The deal that they have allowed options for families to make their own decisions and do what they feel like they need to do. I will say again up front, if my grandchild needed to go, knowing what I know about the effort the schools have put into this, I'm not so sure we're not safer in the schools than we are most of the other places we go. I can promise you they're going to be safer there than they are in the big box stores and some of the group gatherings that have gone on. So, outstanding to our superintendents, to our principals, to our teachers who have gone over and above to make this a safe environment. And the other thing is, and I know safety has to come first, health has to come first, but our children have suffered other things. A lot of folks have suffered other things, mental health issues and those kind of things, safety issues. So we need to do what we can to get these kids back in school. Kudos to our schools, kudos to our school officials who have put eons of dollars and efforts into making these safe.
So are you concerned about the flu?
Take your flu shot. Flu shot is given to anybody. Take your flu shot. Actually, if we did, and I'd like to add one other thing to that. Take your flu shot, but also one of the other things that I beg you to do is consider your school immunizations. Not only when folks go back to school do we don't need flu on top of COVID, but we also don't need measles, mumps, and whooping cough, which we still have on top of COVID. So please, folks, do what we have available in this modern society to take care of our children and to take care of each other.
Can you talk a little bit about, just because we went from very high risk to high risk, yes, it's progress, but this is not over yet. We're still seeing an increased amount of cases.
That is correct. And let me also say to you, we should have all paid a little more attention when we were in math class. Numbers are a funny thing, and you can read them. In fact, sometime if you would like for me to go over the numbers when we have a little more time, I'll talk about that. To some extent, for a lot of folks, myself included, that high-risk map is somewhat confusing. It's also previous data. They report on Fridays what was happening from the previous Saturday back. So to some extent, that is older data, and I think it has to be a big picture thing. You can't just take one picture, one color on a map, and make a decision. And fortunately, our folks have not done that. But just be careful about that data.
Anything else?
Any other questions? Okay. Well, hey, I want to remind you to continue to shop locally and patronize our local businesses. We appreciate the great job that you're doing with that. And beyond that, we will see you back here on Monday, August the 3rd at 10 o'clock. Thank you.